Hey there, it's Dr. Jim. Thanks for stopping by. My topic this week is caring for high acuity residents in skilled nursing. A trend has been developing over the past decade or so involving hospitals discharging seniors sooner to skilled nursing centers, and we've also seen an increase in high acuity or medically complex residents. Populations in skilled care have changed greatly, and it does seem like this trend is going to continue for some time into the future. The level of acuity in skilled nursing centers has never been greater, and some care centers around the country are actually becoming miniature hospitals or subacute care facilities. And some experts say that assisted living now, for instance, is becoming what nursing centers used to be like 20 years ago. So here's a snapshot. Currently, there are 125 million Americans suffering from chronic medical conditions. This burden is magnified when you take into account that chronic health conditions often occur as comorbidities or co-occurring conditions rather than just one single isolated health problem. Of these 125 million people, 60 million have multiple chronic health conditions which are associated with increased levels of disability and decreased quality of life. The occurrence of comorbidity is age-dependent or age-related, with almost 70% of people over age 65 having two or more conditions, so that's important. Acute care hospitals are discharging seniors sooner, and those who cannot go home are being admitted to skilled nursing centers for post-acute care and for treatment. Most skilled centers now serve two very distinct populations, resident populations. Those who are there to receive rehabilitation, for instance, after a knee replacement or a hip replacement, and then they go home a few weeks later. And those who require skilled care for the rest of their lives. With this increase in acuity, there will be both rewards and risks in delivering care to medically complex residents. And I do want to give you some examples of what I'm talking about here. So what kinds of care are provided when skilled nursing centers deliver treatments and care to residents with high acuity and medically complex conditions? Some residents may require long-term ventilation care, for instance. Some will need cardiac or pulmonary treatment. Others will require dialysis. Still, other residents who are older and more frail may have complicated neurodegenerative disorders like Alzheimer's disease and Parkinson's, Huntington's, multiple sclerosis, amyotrophic lateral sclerosis like ALS, and HIV. So those types of conditions will require more training on the care, on the side of care staff. Specialized equipment might be needed. Costs are going to increase. But it also can be very rewarding, obviously, for nursing staff to deliver such high acuity care for residents who have multiple complex conditions. That's all I have for now. I'm Dr. Jim Collins. I'll see you soon.